Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athlete trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another season of AT Corner.
You know in TV shows when they leave you off on a cliffhanger?
Yes.
For season ending, and it's a season ending episode?
Yes.
I feel we don't do that. I feel like it'd be really mean.
That would be mean. I don't even know how we would necessarily do that.
I don't know. I feel like our summer has been a re-energizing, it's full, we have so many ideas for this new season. NATA was really amazing and heartwarming.
Met a lot of people.
Yeah,
honestly,
awesome. It was so much fun. So much networking.
Mm-hmm.
So much connecting.
Yeah, absolutely.
And now here we are. We're back.
And we're back for another season. And for this episode, because I know some people were probably waiting for the episode part, we have an awesome story episode that I think really kicks off the year for everybody.
Physicals.
See, it works. Physicals.
So one of the very first questions I asked on our Instagram story, and I will talk about some changes that we're making this season about these questions, is do you host on-campus physicals for your athletes?
Yes, but I've also been at multiple institutions where we did not.
We do. I actually can't think of a single place that doesn't host.
Oh, that's
physicals.
Funny. I feel like I'm the opposite. I feel like more and more places I see don't do it anymore.
Yeah, I have been a part of so many different physicals.
Yeah.
So many different ones. And actually, I tell my students this. When they're having trouble with their Lockman, I say, what you have to do is you have to go sign up to do physicals.
You'll get a lot
and
of
do
them
the ortho screen. Because that's how I got my Lockman down after doing 200 Lockmans in a row. Boom, solid.
Boom.
I can only practice on Randy's knee so many times.
And it does get sore after a while.
So we did get on our poll, which was a couple hundred responses. Yes was about 51%. No was 49%.
I feel like that's a number that I would probably expect. I would be interested.
Almost half and half.
Yeah, I would almost be interested to see what would it be like over time. Have the no's increased or have the yeses increased? Because I feel like more and more, more people are just kind of being like, nah.
I feel like we've asked this before, but it hasn't. Our listeners have also shifted and changed. So I can't. It's not not submissible for a peer-reviewed study, unfortunately.
Yeah. Publish the results.
Not these ones. The best I could do is a podcast for you.
That works.
So anyway, we are making some changes to our story prompts. We are still asking our story questions on Instagram and getting, that's how we're fielding all of our stories. However, we now have the option for you to sign up for this thing called a broadcast channel, which is somewhat new to me. I'm still trying to figure it out.
Definitely new to me.
It's basically a group message that I think you can reply to, but I think you have to reply in the thread. I don't think it's a big group message like you would just texting your friends.
Yeah.
But basically, if you subscribe to that, every single time we post story questions, I will message out story prompts are up so you don't miss them. And this will help too, because I would really like to post more on our Instagram story. And I know some people had the post notifications on for the story.
Yeah.
But I don't want you guys to get over bombarded with some of our other stuff that we're posting and then you miss the story prompts. So the broadcast channel, yes, there will be polls and different things as I figure more of it out, but I would really like it to be more of an alerting system for the story prompts.
Yeah. Hopefully it keeps them all in kind of one spot.
Yeah. And it also I know sometimes especially since we're starting a new season and we haven't put the story prompts out in a couple months, like our story might be like behind for a while,
Yeah.
you know, like it won't like pop up first. So I would really like for people to still be able to like find them.
For sure.
Or if they like listen to this episode, they're like, dang it, I didn't get to submit my story.
Yeah.
But we still got a good plethora of different stories this round, and a lot of them that we didn't have like a lot of like repeats, which was like really nice to sort through. And I think we have some really good like different perspectives on things.
Yeah,
too.
I'm really excited because I do want to know what other people do for their physicals, because we all know
Yes.
physicals, it could be a cluster. We know that day is you leave shell shocked.
Yes. So actually the first one I put in is a voice note, which I was so excited to get. And I'm going to play it for you right now. It is from Robert M. He is talking about how the physicals that he does go.
I work for a local hospital chain, but the largest hospital in this small rural area. We employ 9 athletic trainers between the local college and 2 high schools. We work with our local family medicine facility, so we get a couple providers from there. And so we have the standard stuff: height, weight, blood pressure, vision. We do a functional ortho screen. We will review any injuries and such. And then a physician or a PA will go over the state required PPE form with them. And then we have also partnered with a nonprofit organization called Who We Play For that does EKG screenings to look for heart defects in kids that are otherwise asymptomatic at just $25. So we offer that completely free for all of our student athletes in the community. And then since we all use Healthy Roster as a system, what we do is at the end is we upload those PPE forms into everyone's Healthy Roster, make sure all the contact information is up to date. And it really saves a lot of time in getting all of our valid or important medical records at one go.
Nice.
He also said the event lasts 5 days. The past year they saw 217 athletes, and they're there for about 4 hours a day, with the kids being scheduled within in 15-minute slots.
Like individual kids, or that's what I'd be interested.
Like I'm the way that I took it is like someone's scheduled for 3, someone's scheduled for 3:15, someone's scheduled for 3:30. Not that it only takes 15 minutes.
Yeah, of course. But like
those are
when
their
they're
time
going
slots.
through it. Yeah.
Yeah.
That's interesting. That's cool. That's very organized, and I think that's a good way of just like, we know, like, it's going to be a lot. But like, it's coming. And you have it, it's like, it's just boom, just here, just rip the Band-Aid, we're going to focus on this, get it done.
I was super excited to hear that like a local hospital did it. Like I've seen, I mean, I guess there are high schools that with athletic trainers like contracted out through, but I'm trying to like picture.
You know what's funny is with you saying that, like, I feel like that's not big in SoCal. Like,
it's not as big. You're right.
That's what I'm trying to think. Like, I can't think of a lot of hospital systems down here that do this, like where they employ ATs and then send them out to like the local schools. I feel like that's more like, I know some in Northern California do it, and obviously I've definitely heard it in various states in the U.S., but I feel like in SoCal that's not really a thing yet. Yeah.
Not as much, but I mean, so like maybe this is. I'm just trying to picture. The only other physical that I know of that wasn't through a like specific like school. I feel like some of the high schools do like joint physicals around here, but I don't think it's necessarily like through the hospital.
Like maybe within the district.
But I did volunteer when I was in grad school. I volunteered, and I barely remember this. I remember going. I have no idea who told me about it. but it was for a performing arts like PPE basically. And it was for anyone in the community, a performing artist who just wanted to come through, like do a health screening. And it wasn't just like we had PTs and we had a bunch of different specialties. Awesome. But like we did movement screens, but that was just like a piece of it. There was like, you met with a nutritionist, you met with different mental health people, you met with like there were so many different stations, and I can't remember. If I can find it, I'm gonna try to find the name. Like it wasn't like Dance USA. Mm-hmm. I don't remember who it was through, but it's basically put on for any professional dancer.
That's dope. It
was really cool. Yeah. And I haven't ever gone back because I never heard anything about it again. And again, I don't remember who like connected me to it. Yeah. But that was like a community physical.
Yeah. Yeah, that's pretty cool. That's pretty dope.
Do you want to read this next one from Hayley?
Yes. Hayley S says, I work for a Division II high school in Ohio. We had 4 doctors, 7 ATs, and a chiropractor. The AT did the ortho portion, which was just basic range of motion of all joints and a duck walk. There are 2 ATs at each station, or 1 AT and the chiropractor. So 1 AT took height, weight, and vitals, and then the other did the musculoskeletal. Then the athletes would go to the doctor for full clearance with heart and lung check. We had about 120 athletes come through over a 2-day period. Each day we offered physicals 3 to 5. That's kind of interesting. That's kind of cool.
Mm-hmm. I feel like that's a pretty good time frame too.
Yeah.
Like ours, we have about 400, less than 400 athletes probably who come through our physicals.
Yeah.
And we do them on 4 different days.
Nice.
So we do, the first day is football. The second day is most of the other fall sports. Mm-hmm. The third day is some fall sports and winter sports. And then the fourth day is all the spring sports.
Yeah.
And that's a generalization. But then we have different stations as well. So we have usually 1 to 2 of our fellows come through, our ortho fellows, and they do an orthopedic exam. We have our nurses from the health center come by.
That's nice.
And they do heart and lung, which is really nice. So then the orthos don't have to do it. And they also do a med history check for the nurses do. So basically when they come through, they start with their sportswear and they do all their sportswear stuff. And then they go do their blood pressure first, also with people from the health center. And then they fill out their med history portion of the physical, go into the next room, do height, weight. And then one of our athletic trainers comes by and does a med history review and highlights anything that needs to be reviewed by the nurse practitioners. Yeah. And then there's basically like 2 lines, and it's like you can go in either line, and we stack their papers, and then it's like, okay, so you're next up, and then we call you for either line, and we just make sure they go to the nurse or the ortho, and then we make sure that whichever one they went to, they
do the opposite.
Yeah. You have to go through both, and then you check out with me, and then I check your sportswear, I check your physical, I write down any follow-ups, and then you pay, which is a fundraiser for us.
So how do you guys do the med history review? Like, I don't know.
What do you mean?
Like, how do you guys go through the med history with them?
Any yes
because
answers?
Do they do it, because I'm assuming, do they do it ahead of time and then they give it to you and then you're looking at it, or do you literally go through it with them?
No. They already fill it out.
Okay. Gotcha. And then you just, any yeses?
Any yeses. And then our nurses do a good job of, if they have no yeses, they kind of dig a little bit deeper. They don't just take it for face value.
Yeah.
Yeah. So I guess it kind of depends on who you get.
Yeah.
But like we try to dig a little bit.
Oh yeah. My favorite is when I'll have like a football guy come in and like all their musculoskeletals, no. And I'll look at them and like, so you've never been injured? And they're like, no. I'm like, so you've never had pain before? Never. And they're like, oh, well, I thought it was like major stuff.
I mean, I had surgery.
Yeah. Or like, oh, like I've sprained my ankle. I'm like, that would be one thing to list. Yes, thank you.
One time I did ask a kid, I think I said this in the last physicals episode we did. One time I had a kid that I said, I was about to do an ortho screen starting, I must have started his ankles because it was the first thing I asked him. And I said, have you ever sprained your ankle before? And he said, no. And then I did a tailor tilt inversion and he like almost jumped off the table. And I was like,
my ankle hurts.
Are you okay? And he was like, yeah, I just hurt my ankle last week. And I was like, oh, well.
See, that's why I've started asking. So you've never had pain before?
You got to make it their language, you know? Maybe he didn't know that was what a sprained ankle
exactly,
was.
Yeah. Because that's my thing. It's like, no, sprain, nothing. And they're like, oh, I've rolled it. I'm like, well, okay. Well, technically, that's probably a sprain, but my guy.
So this next one is anonymous. They said, I'm starting my second year at a private K through 12, and it's definitely interesting how they've been running it before I got here. Students have had to get a physical every 2 years. It's uploaded to their online portal, and it's supposed to be verified by our school nurse. Key phrase is supposed to be.
There we go.
Because I found out in the spring that they fell off with doing so a few years back. So now the AD thinks it's his job, and my anxiety has me running through all of them myself anyway, so I'm not blindsided during an eval. Also, we have a lot of international boarding students for 9th through 12th grade, so many of them get school standardized and very minimal form signed off by physicians in their home country. I follow up with my asthma, type 1 diabetes, and concussion patients or anything else that stands out. Private schools are wild.
Dude, let me tell you about the international medical system, especially when you're working at like a 4-year that is following like the NCAA's like sickle cell.
Mm-hmm.
Trying to get European doctors on board with, why does this person need to be sickle cell tested? I'm just like, I understand, but we just need them to.
Right.
And my favorite was when I actually had a doctor ask me, what test is it? I'm like, oh no, my guy, I need you to know that. So then I had to look it up, tell this doctor it's this test that I need them to run.
That's pretty funny.
Yeah, it was pretty wild.
Well, that was nice that they kind of trusted you.
Yeah.
They're like, I'll run it. Just tell me what I need to do.
I mean, I get it from their standpoint.
Yeah,
They're like, this population, they definitely, like, there's probably less than a 1% chance that they have it. But it's just, dude, it's the rules. What do you want me to do?
Yeah. By the way, anonymous, it is not your anxiety that you are running through all of them. You should probably, I think everyone should be going through their physicals. So this next one is from Mason B, and it's really interesting. I've never actually heard this before. Super excited to share this. The American Academy of Pediatrics came out against mass physicals in 2019 and 2020, or 2019, 2020-ish, and the American Academy of Family Physicians in 2021. So our hospital system stopped providing them.
That's interesting. I would be interested to see like the publication on that, because I'd be interested to like
he did send the family physicians one.
Dope.
The AAP one is behind a paywall, so he didn't send that one.
We might be able to find that.
We'll look.
Oh yeah.
So Mason says, but it makes sense. I've seen one physician go through the entire list with a room of 10 high schoolers at the same time, $20 a head. I think this was the type of practice they were hoping to discourage. Someone just checking off boxes as a cash grab. Another point I think about with the AAP and AAFP, physicians were doing mass physicals for 2 to 3 hours after a full clinic/surgical day. Not only are they exhausted, but their brains get into a rhythm of just going through the motions of one physical after the next. Very easy for things to be missed in a scenario like that. At least when we did it at the university, every station was pretty much solo except blood pressure, vision, and height weight. So on ortho one-on-one, primary care one-on-one, they were flagged by the AT reviewing histories, or by either physician. They'd see cardiology, mental health, and or nutrition one-on-one.
Yeah, I agree. I think, I mean, I get why like that was like frowned upon.
Right.
Because
I've never heard, that's crazy. Like I
feel like more people would talk about that.
How do you get I can't imagine doing a group physical. Like HIPAA.
Oh yeah. Yeah, that one's wild. But I think just in general, just like Mason was saying, like a lot of times, the surgeon or the doctor's coming in after their work day,
yes.
or even in the middle of like our physician, our team physician's in ortho.
Mm-hmm.
So middle of his days, like he comes after a surgery sometimes, right? And then he probably has a surgery later. Like he's
Mm-hmm.
cutting out time to do this.
Mm-hmm.
Like that's really hard to lock in. And then, yeah, it does kind of turn into like, hey, we're just trying to get these kids,
Right.
like, let's get them in and out.
Mm-hmm.
So I could see why like organizations are saying like, hey, this probably isn't good.
Yeah.
It's probably not the best way to handle these things. Whereas if the kids are kind of like, hey, they're kind of responsible for getting it, at least they're going to a provider where it's in their work day. They are theoretically getting that one-on-one. So I could see why that was, hey, we probably shouldn't be doing mass physicals.
See, I see what you're saying.
Yeah.
I feel like the student athletes who go to our physicals are
Yes.
getting a much better health
Absolutely.
screening than they are if they go to some random urgent care
For
that
sure.
has no idea how to do an ortho screen.
For sure. And I think that's like a key component of it is like if it could be organized in a certain way, kind of like you're saying, like how they were at the university, like something like that, where it's very organized like that. I think you can probably get away with it where there's more help. Like if you have multiple stations, stuff like that, I think that can help probably alleviate some of the concern.
I mean, even I volunteered for the Anaheim Ducks physicals, and they did, I mean, it's not that many of them, but like they did a mass physical event where they had multiple stations and everyone was going through and it was the same. They're also doing media day at the same time. And like,
well, again, that makes sense too for them because I'm sure they had a lot of help.
They did.
Smaller group.
Exactly.
And they're getting more with it. Like,
right.
So it could definitely be done. I think it's probably the manner that it's done is what makes it good and what makes it doesn't. Yeah, if you're doing like, if you have kids in a room, yeah, you're just checking boxes at that point.
So I did also ask, what does an athlete need to do to be medically cleared in your setting? The top answer was a physical physical. There was a little bit debate on whether people said within a year or within the last 2 years, which would have been a good follow-up question. I don't know that we would have had like, I don't know where our samples were coming from necessarily. So I'm sure like some people like Hayley S, she she's in Ohio and their physicals expire every 13 months.
Interesting.
So, I mean, it does kind of depend on like where you're at.
Yeah.
I think even I have to look again to see. I don't think we need to require a physical every year, but I think, well, we do.
I was gonna say
but I don't think that by our bylaws, I don't think we have to.
Our level says they need one physical and then everything after is up to the institution and what they want. So that's where we are. We require a physical when they're incoming, and then the next year it's just an update. But you do have discretion. Like if this kid like disappears, like halfway through the year, and I don't ever see this kid again, I'm gonna make them get a physical because like I don't know what happened to you.
Right.
But if you're with us the entire time, then like I pretty much know.
See, I feel like it's a lot easier to be like, okay, this is what you need to do for medical eligibility. Like I do, everyone, I go to the meeting at the beginning of the season and I say, okay, you need a physical, you need a concussion test, and you need sportswear with all your forms done and everything filled out. Now, the concussion test, we keep on file.
Yeah.
Unless you have a concussion and then you redo it.
Oh, okay. Interesting. Nice.
But like we just, everything else, I mean, updated. Because I mean, the updated physical also, they're going to get an updated blood pressure, updated everything. It
was really nice at the university. We did, because again, like NCAA, NAIA, you have the potential to have athletes 4 or 5 years. Again, it was the same thing when they're incoming, just a physical. And after that, each year was just an update. Medical
every year.
Update.
So you could have like a 4-year-old physical.
Because they're with us the entire time, and we know everything that's pretty much going on with them.
I've never worked professionally at that level. I've never worked at more than a 2-year.
Yeah.
So, interesting.
Yeah. Now again, same thing. Like if the kid like leaves, like quit the team, and then all of a sudden decided, no, I'm back, then yeah, I'm gonna be like, you need to get another physical, my guy.
Right.
But yeah, there were some people after their freshman year, they never got another physical with us because again, they're around us, we know what's going on.
Mm-hmm. So in order from most common to least common in the responses, medical history, check, a concussion test, an ortho screen, some sort of forms like waivers, consent to treat in their EMR, an EKG and or echo. I was surprised to see that was so common, actually.
I know, that's interesting. That's cool.
A mental health screen.
Hell yeah.
Such as like an adapted PHQ-9 or some other questions that people use. Actually, 74% of people, this is a separate question, 74% of people said they do include mental health questions on their physical, which is so much more than I think when we asked last time.
That's good.
And yeah, I'm seeing that this is like transitioning a lot more. I would be interested to see what people do with them. For us, we do have mental health questions, and I kind of make a generic statement for everyone, and I started off with, okay, anyone who puts even one yes answer on this, so basically like I'm not freaking them out by anyone who has at least one yes in this section, I just give mental health resources no matter what, like how big, how little. And then there's also a question on there that says, do you want to follow up with a mental health professional, or do you want to make an appointment with a mental health professional? And I do, even if they write no, I ask it anyway. And then I tell them, you don't have to decide today. You don't have to decide tomorrow. You can decide in 2 months. You can decide whenever. Just come in, talk to one of the three of us, and you don't have to say anything. You just say, hey, can you help me make that appointment? And then I'll take care of the rest.
Yeah. We really proud of our screen because I basically took this one from one of my previous institutions at the D1 level and brought it to the community college, and we screen for like anxiety, depression, disordered eating. And then there's like some other questions in there. So same thing. Like if I notice, like what I want to do is just give everyone the resource. Well, a lot going on here. Perfect dream would be mental health professionals a part of the physical, so they can actually screen them.
Awesome.
Which I'm working on it. One day it's going to happen. Because that's what we did at the D1 level. We actually had a day where mental health professionals would, because we didn't do our own physicals. So basically our physicals were mental health physicals, I guess, where they'd actually meet with the CAP staff, and they would basically do the triage part, right? They'd screen them. So people who had like nothing, like basically all no's and didn't have anything to report, basically it was just I work at CAPS. This is CAPS. Here's how you kind of like, so they could put
me in case you need it.
Yeah, they could put a face to the name and stuff like that. But yeah, so that would be perfect world. But what I want to do is like, kind of like you said, like just, so it's not like, oh, the person who got the information, like, oh, something's wrong with them. Just get the mental health information to all the student athletes, and then they have it. And then now the screen's not like, But I do have to say, the mental health screening has been huge because I feel like it makes student athletes comfortable talking about it with you because they know you do this. Like I feel like I've had more student athletes reach out about like, hey, I am interested in an appointment because of this than before it was introduced. That's
a really good point. Really, really good point. So I feel like it opens the door.
Yeah, and at least what I think, I don't know if student athletes think this way, but I feel like it shows that like, hey, like we want to talk about it. Like we're okay with you not being okay.
You know what, actually, speaking of this year in physicals, I actually don't think I had normally I have maybe 10% of the people who I need to follow up with for mental health, and I'm making several appointments. I don't think I needed to follow up with a single person for mental. I gave out resources.
Yeah.
I didn't need to make up any follow-up appointments, which I thought was really interesting. Now, several of them who were flagged were already working with a mental health professional, so I don't know like specifically, but I think that it's really interesting actually, because I feel like the stigma has been changing.
Yeah, slowly. It's getting better.
But I feel like we were seeing a lot of being open about mental health. But I feel like this was the first year that I kind of noticed people are actually doing okay.
Yeah. You know what? Some of the stuff that's in the literature that I've noticed is a lot of student athletes want to seek help. Like it's not necessarily, it's getting better to where that's not the problem anymore, that they're just not wanting to seek help. They want it. They just don't know how to access it, or it's hard for them to access it because of schedule and like stuff like that. So, and I've actually had in our mental health screen, one of the questions are, have you worked with someone in the past? And I've actually gotten a lot of yeses. So I think that kind of relates to what you're saying. Like, I think a lot of people have sought help.
Right.
And feel pretty good.
Yeah. I mean, it also could be, I mean, I don't know, like return or new people wise, but I mean, if a lot of these were also addressed last year, like you were saying, and maybe just the new incoming, they've also had something addressed, previously, but I don't know. It was a good year for us for mental health so far.
Nice.
Some other top answers, actually less common, blood pressure check and emergency medication care plans.
Ooh, smart.
So Chris H says, for emergency medical care plans, they have to be filled out by the physician they are seeing for the conditions. South Texas has an asthma action form that we use. It's honestly the most user-friendly one that I have ever used. It uses a stoplight system for albuterol use, and at what point when it becomes a medical emergency, which is super nice, especially with the middle school coaches. They also have a Spanish one as well. Diabetes plans can be on a template, but if complex, it can be pages long. Seizures are the only ones that require a meeting with our team physician. And then he sent in the form. It's actually also from the AAP for the South Texas Asthma Action Plan. I'm pretty sure that's the one that he sent over, and it looks pretty cool.
Nice. Sweet.
And that's another thing from that I was going to say about our mass physicals too, is like our, like how I was saying before, how our like nurses go into depth about something.
Yeah.
It's really nice because so I'm in the same area as like the nurses and the ortho, so I can be accessible for both of them. So if we have someone who needs to follow up with something, and we do spread them out enough that like even the chairs, we don't have a lot of people waiting by the nurses or the orthos, and the people who are waiting are far enough away out of earshot. Yeah. So it should be pretty private. But if there is someone who, like, for example, we had a lot of people this year who need to follow up for their asthma, like their asthma is not as controlled as it used to be. So their prescription needs to be like tweaked a little bit. So like they might not have written that right on their plan, but that's something, or not on their plan, on their medical history, but that's something that our nurse is following up with. And that's something that like maybe some random provider at urgent care might do, but someone might not do, especially someone who's not as familiar with sport specifically, if they're seeing a different population all day long. So that is something that I feel like is a benefit of our physicals, is they actually go into depth about certain things that I feel like I haven't gotten from, if someone says all no's on something, like how many follow-up questions are you getting from whatever provider you went to?
And the form saying that's really cool. I really want to do one for the diabetes, just to be consistent with the position statement, which we did do an episode on, where they talked about having a nice care plan. I want to make a form for that, because I think that's a great idea.
Which should be a CEU.
It is.
Shout out to Athletic Training Chat and Clinically Pressed for providing our CEUs. Thank you so much. So if you're interested in those, scroll down to the show notes below. We have several free and several purchasable, very affordable for your reporting year.
That's right.
So Kjersten M says our returners only have their blood pressures checked. We recheck all of the high ones a day or so later, and lots are fine, like white coat syndrome, which we get a lot of that too. Usually those that stay high have high blood pressure and might be on medication, so we keep those numbers as a baseline for our records.
Yeah, we do that for our returners. Like that's their like returner physical, is we basically update BP, pulse, and weight.
What do you so you do physicals not on one single day? Can you explain a little bit of?
We do it like you guys. So we have 4 physical dates. One is exclusively for football. Mm-hmm. Right, so we just bang out football. Mm-hmm. And then one's for all the rest of the fall sports. And then the third one we do before the non-traditional season for spring sports. So like they're like fall ball. Mm-hmm. So we do a physical for them to get cleared for that. And then we'll do a spring physical in January for spring sports. So for anyone that came in late, anyone who's just like, because a lot of times like swim and track, like they don't really do that much in the fall. So they'll be bringing people in for the spring.
Right.
So that's kind of how we do ours.
Mm-hmm. But you do it on 2 different parts. You don't do it all in one day.
Oh yeah, no. So that's another difference. We do what's called like pre-screens, where we do everything that you would normally see in a physical, like the vitals, the ortho screen, and like the med history review, their forms, all that. And then our actual like physical day, literally the kids just seeing the doctor and then leaving. And that's it. Theoretically. Now,
do you have a problem with people not being able to make it to 2 days? Because we were gonna do that with ours, but then we were worried about like, well, what if someone only does half of their physical, or like what if someone just shows up to the physical thinking like without doing anything beforehand, or like
not really. That's what makes our physical day like not necessarily like just see the doctor, because there's always a kid that's like wasn't there for the pre-screen and then wants to try and get their physical done, which is fine, but then you look at their sportswear and stuff and they did nothing, and you're like, dog, you've had weeks to do this.
Right.
So I don't think that's necessarily a concern, because the pre-screen, we kind of work it out with the coach. Hey, what day is going to be good for you guys? And their coach gets them here. So we do get a majority of our student athletes that way. I think the limitation of it, or what I'm more concerned about, is just when we're doing them. Like a lot of times it's after the kids practice. So you try and do their vitals and they're through the roof. And you're like, bro, now I got to wait. Right. And you got to do it again. Right. So are you getting a true resting? And then also too, like making sure the kids get their sportswear done before we do the pre-screen. Because the whole point is so I can look at your history, do your ortho. But if you haven't touched your sportswear,
that's hard.
You now have to go do that.
Right. So
I think it's that, like making sure they're all done with that stuff ahead of time before I even see them is a huge help. So like for my teams, I bug the hell out of them like weeks before they're like quote unquote pre-screen, like get this done. You still need to get this done. And it does work. I'm
lucky that I only have to really yell at football in the fall.
And most people wouldn't say that.
It's hurting cats sometimes, but it is. But it's only one team. I mean, they're like a bunch of mini teams together, but at least there's one kind of collective. Yeah. But we put them in a computer lab beforehand.
Most years I do that.
And I do it all together, yeah.
Most years I do that because again, completely understandable. Like some of these kids are 17, 18 years old. You're asking them to fill out forms that mom, dad, guardian, like anyone else used to do besides them. And you're asking them about insurance. Like they don't know. So there's a lot of questions, and that's okay.
Right.
So that's why I liked doing it that way. But this year I didn't really do that. And it actually worked out fine. I was actually pretty surprised that there weren't as many like, what'd you do here, dude? Yeah, so I was pretty proud of them.
Nice. So David H. says, we have mass physicals where we bring in our RN program, MA program, and local ROP CTE students to help with vitals. Our MSAT students help fill in the cracks. We got through 130 2 weeks ago and have another 140 this Monday, each time with 6 providers from our team physician's office. 6, that's nice.
I know, that is nice.
We used to have around that at a different place that I used to work, but we only did 1 physical day. So I think having it would be nice if we could have 2 every time, but we really only have 1 sometimes.
Same. We sometimes just have 1.
Which is a bummer. I mean, mostly for them. They have to do 60 in a day.
And again, like we talked about, it's in the middle of their day or after their day.
Right. They complete their medical history for doc to review prior to their physical, and they upload a picture of the front and back onto our EMR Sportswear. Once they complete their basic info, medical insurance card upload, medical forms we require, and then upload their physical and medical history, they do their concussion test, and they're cleared. Sportswear has... Actually, that sounds very similar to mine.
Yeah.
Sportswear has a function that we can print reports showing who has what missing, and we color code it and send it to coaches so they can send them in. If doc makes a mark on their physical for follow-up, we act accordingly. Usually it's a monitor this or tape this, or rarely I want an image for this first. If it's something more in depth, then we talk to doc with the student athlete present.
Nice.
So we kind of already talked about this, but I also did ask if you require a new physical every year of participation, and 76% of people said yes.
I'm surprised.
24% of people said no.
I feel like I'm surprised by that number. I mean, I don't know how many of it, again, I'm biased because just being at non-high school level, college, university, I feel I remember high schools, they had to do it every year, so I figured or a lot of those come from high school, but I don't know. I'm surprised by that.
Yeah, I am not, because we always did. So.
Yeah. See, it's based on your experience.
Kristen L says, I work in collegiate NAIA. We have sport physicals mandatory every 2 years, and they have to be completed on our physical form.
Oh, that was a big thing.
What?
Yeah, we were like that. It has to be on our form.
That's what us too. It has to be on our form, because you can get so many different things everywhere. We want it to, because if they get a physical somewhere else, we're not screening them. They're not screening them for mental health.
Yeah.
Or if they get somewhere, whatever, they're not screening them for the same questions we ask.
Yeah. So. One thing that I've noticed, I've gotten a couple times that I feel really bad about, but I can't do anything with it, is when a kid gets a physical, your normal health physical, and they bring all the forms and it's so detailed, all this stuff of what was checked, but it's not a sports physical. Oh. So there's nothing that says you are cleared for participation.
Oh, I don't really get that. I've
gotten it a couple times, and I look at them unfortunately, man, I can't take this. It doesn't say you're cleared for sport.
I usually, if I get anything like that, that's because usually it's just not on our forms.
Yeah.
So I usually just say, hey, call the office and see when you can come back to just get it signed.
Yeah.
Because usually they don't have to make another appointment.
Yeah. And
if they already have a physical.
In those cases, that's what I'll tell them. Hey, take this form, see if they're okay at least just filling this out since you already did this.
Right. Kristen continues, all physicals, risk consent forms, drug consent forms, insurance info, etc. gets uploaded under each athlete in our EMR system. Then we have a spreadsheet that we track everything on and check off as they complete things. So that's nice. Very similar to
Yeah.
Justin N says, I think it really depends on your resources you have. I really like this this take. I don't think you want to overwhelm your docs by making every single kid get a physical every year unless something drastic happened the prior year.
Yeah.
I think new kids and anybody who had something happen within the past year, such as anybody who received a concussion or had surgery the year prior, seems like a bit of a burden on your team physicians to have a bunch of healthy athletes that nothing happened to have them go through the entire physical process again.
Yeah, I get that. I mean, that's why I like again, we would do one, and then for the rest of the 4 years, or for the rest of the 3.
Wait, do you require your returners to get a new physical?
No. No, it's a medical history update, and then our returner physical, which is just updating vitals, which even then, I'm kind of do we really
need to?
Because, again, every other institution I've been to, we never did that. And, we did fine.
I mean, do you ever use that? I use the blood pressure, when I'm checking vitals, I'll check to see what their normal blood pressure is.
I do it like after, like I'll look to see, are we seeing any differences? But again, like I said, like sometimes our pre-screens, it's after the practice. So it's like,
oh, that's hard.
I know. That's one limitation of it. But that's why a part of me is like, I mean, they don't really change that much. So unless I had someone that like all of a sudden started having cardiac symptoms like within the year, I think that would be a better way to do it.
Yeah.
But I don't know. I kind of want to get rid of that.
Yeah. I feel like it's hard because I can see how both sides. I guess also depends on institution.
Yeah, and what your team doc wants, right? Like team doc technically is overseeing this, so if they want that, they want that. I
mean, like this is a first time for me. We had a kid who, like we don't normally check. I don't really pay attention to their weights like at all, but our nurses caught two. That their weights have changed drastically. One of them had been because of a surgery, and one of them, I'm suspecting some GI issues. And one of them was new, and one of them was a returner. So it's really interesting that weight was caught on the physical. That it probably wouldn't have been. Yeah. And that's the thing is like, how do I know who to like? Yeah. I wouldn't have known about this returner. Yeah. So I don't know. I think it's helpful. Going back to Hayley's, we were talking about the 13-month thing. She said, since I am in Ohio, physicals expire every 13 months. All fall athletes need to have a physical on file by August 1st to be eligible in any forms through the athletic department filled out. Concussion understanding, Lindsay's Law, emergency contact forms, etc. In Ohio, the 13th month is like a leeway month to get it in on time. Students need to have a physical on file with the office before they can participate. My coach only sees the time frame left for the physical, like a countdown until it expired, and then the secretary only uploads the physical that has been checked off, the exam date, and that they're medically eligible. Nice. So I also asked, what are some reasons your athletes are not cleared on their physical? Most common answers, actually we had two most common answers, cardiac clearance and post-surgical. Nice. And they need some sort of clearance from that.
Yeah, I would say the cardiac. I mean, yeah, definitely.
We get a ton of cardiac.
Definitely the post-surgical, but surprisingly, we've had neuro.
Really?
We've had, the past couple of years, we've had some kids with neuro.
Like?
I actually had a kid with drop foot.
Oh.
And like I told the doc, and he looked at me like, drop foot? I was like, yeah, that's the only way I could describe this. And we were looking, I was like, holy smokes, he does kind of have drop foot. Yeah. And then
what happened? Did they?
It wasn't really my athlete, so like, I don't know what ended up happening to them. Like the doc wanted them to check in with a neuro.
You know what? Last year I had a couple of neuros too. Yeah. And last year I had a couple of incoming football players who had previously fractured vertebrae.
Oh, love that.
I can't remember if I had 2 or 3. And I was like, it is 2 or 3 too many. Yeah. That's crazy. Yes. Oh, I think it was 2, but then one of them had history of being spine boarded, but didn't have any fractures. So I think that's what it was. Crazy though. Yeah. We get a lot of, and then I also had a weird neuro, that their pinky wouldn't stop moving.
That's wild.
Yeah. Cardiac clearance, we get a lot. High blood pressure, we get a lot. Yeah. I've had high blood pressure that still with rechecks wouldn't come down, so we just send and they get on meds and then they're fine. Nice. Blood pressure was another high reason why people are not cleared, but not as high as vision.
That's interesting.
We had a lot of people say that vision wasn't clearing athletes, which we, at my current school, we don't check vision.
We don't check vision.
But we've checked. I've checked. It's been part of our check before. Yeah, not at this current school, but like other places. Like I've been at places that they check vision.
Oh yeah, I remember those days.
This one from Anonymous says, heart murmurs and hernias are the top 2 I see.
Hernia's crazy.
I know, right? I thought that was crazy too. Most of them, after doc hears a murmur, they will send them to get a cardiac clearance. Hernias, I've had 1 or 2 every year. It's usually boys with inguinal hernias. They get sent for surgery and then they're good. The recovery is not long at all. They can start working out after a couple weeks and they're fully cleared for sports around 6 to 8 weeks. So if they were good and planned ahead, they really don't miss much of their season.
Nice.
Yeah. I only have 2 more things left. So we're kind of wrapping up here. But the weirdest answer that you've seen on a physical, I had to include this one.
Of course.
What is the weirdest thing that you've seen on a physical?
See, now I don't remember. I'm trying to think. Because I feel like it's never really the answers, like on the form. It's their explanation of things. And I'm trying to think. I can't think of. Most of the time, it's like sometimes like just a condition I've like never heard of, or like just some kids like what they're dealing with. I'm like, oh my gosh.
Right.
That's crazy.
We've changed ours. I think I saw this somewhere and I was like, I need to change ours immediately, because you know how usually it's like you have the question and the little yes, no, and then at the end it's like, explain all your answers here, and they're all jumbled in this paragraph. Like, no, we're not doing that. So what we've changed it to do instead is each question has a little, there's a yes, no, but the yes is way bigger than the no, and so they have a little spot to write something. And then if it's not big enough, they can write it at the end.
So, nice. So
they can't just like check mark the yes. They actually have to write a little explanation.
So we do our medical history like on sportswear. So we use the history function. And there's you can tab yes or no. And then there's a comment section where they are supposed to explain it.
Yes.
Right next to the question, right next to it.
Right.
I'm going to emphasize right next to it. And no matter how many times I tell them, like if they're in person, if you check yes, explain it here. If you check yes, explain it here.
They don't have like a required.
No. I should look to see if that's possible, but I don't think so.
See, we don't do the sportswear med history anymore because we do it on the physical and no one checks the sportswear med history. So I feel like it's redundant.
Yeah.
But you use it for your returners, right?
Yeah. Yeah. But no. Actually, the returners, their med history update is one of the forms in sportswear.
Oh, interesting.
Yeah, it's wild stuff. But now, that's actually a good point. Maybe we should switch it.
Yeah, you should.
But we did do, like where I was at before, their medical history was a form on sportswear, like the actual form. And same thing. You have all the questions and yes, and then at the end they would explain it, right? Same problem. No one explains it. So even after I tell them, hey, explain it here, I'll go through their history and there's like yeses. I'm like,
you're supposed to explain this.
Yeah. Don't you think I want to know more?
Right.
Like, don't you think I need to know what yes, I've had knee pain. Can we explain this a little bit?
So the weirdest answer that I've gotten was something, I think it was last year. Someone wrote that under their allergies section, they wrote they were allergic to seafood, but only if they eat seafood and then work out after.
This is crazy.
So like they can eat seafood just fine. They can eat seafood every day of the week. But if they eat seafood and then they work out, they will go into anaphylactic shock.
Well, hold on, babe. They can't eat seafood every day of the week. You can't eat it on leg day.
Correct. Because they had an EpiPen for it. I was like, how did you figure this out?
Yeah, I was going to say for the physicians and the athlete to figure that out.
So it was something about they were from the South, and so seafood is something they eat a lot. And so they were like, I like would never have a problem with it, but every single time it happened, like I'd be working out and I'd figure out that like I had seafood beforehand. And I think they related it to somehow like the inflammation of like working out, like that created like, I don't know. They explained it to me, but that was their doctor's best guess of what was happening.
I mean, it makes sense.
Okay, some other ones we've gotten. Someone said they were allergic to pre-rep.
That one's wild.
I wonder if it was more like a heat rash,
maybe.
Or like a folliculitis.
Yeah.
Spleen tore in half.
That's wild. I would want to know the story. So much more to that.
You know what? this is going to drive me crazy, but I was sitting checking out, and I was within, because I'm sitting pretty close to the nurses, I was within earshot of the nurses, and the nurse said to someone, she was asking questions and I wasn't really paying attention, and she said, well, she was saying so, and then she was like, well, I mean, that makes for a really crazy story. And I was like, dang, I missed it. I don't know what they're talking about. But I, like, the person came through and I totally did not ask what the crazy story was, and I didn't see anything crazy on the physical, so I will never know.
Yeah.
Although one of my guys, previously, I think I've shared this before, it wasn't on his physical, because he was scared that it was going to make him disqualified somehow. I don't know. But I was treating him. I don't remember what I was treating him for, but he said that he had previously fractured hhis pelvis. And I said, how? How did you do that? And he said when he was a kid, his dad worked for like a logging company.
Oh, okay.
And he and his brother were like playing on the logs, and the logs started rolling.
No.
Yeah. And so somehow he fell, and the log like rolled all the way up to his pelvis.
Oh.
And so crushed everything from hips down.
Dang.
But didn't, I don't know if someone stopped it or if it just like momentum like stopped, and then rolled back down.
That's wild.
Right. And I was like, dude, I don't remember seeing this on your physical. Like, I would have remembered seeing like you broke every bone from the hips down.
Yeah.
And you were hospitalized. But no, he was like, no, I didn't write anything.
Wow.
I was scared it was going to make me disqualified. It's like, no, you're fine. That's crazy.
I would like to know that though.
Yes. David H said this.
Oh, hold on. We got one more that I've been waiting for.
Oh, you want to read this mental health one?
Yes. To a mental health question, someone had, I'm an anxious girly, but I'm okay. That's funny. That's what I was waiting for. I think that's hilarious because I'm for sure one of my athletes would put that down.
Oh, yeah. Mm-hmm.
I thought that was hilarious. All right. You may continue.
David H said, this one is new for me. We have my first student athlete with a confirmed heart condition. He is cleared to play, but we monitor him closely. He has tetralogy of Fallot. Is that how you say it?
Sure.
It is surgically repaired when he was an infant, and he has monthly checkups with his cardiologist. Doc brought me over and clarified it for the student athlete and has a card they have everywhere, so if they go to the ER or something, they can show that.
Oh, dope.
Yeah. I feel like I've heard of that before. I can not tell you a single thing about it, but I think I've heard of it.
I don't think I have.
I'm going to look it up after we're done
usually this
recording.
is where I learn about conditions is through physicals.
Yeah, G6PD, I had no idea what that was.
Right, you get stuff like that and you're like, you have to look it up and like, oh, see, look, I learned something new.
We have a section that asks about their medications and like what they're taking, if they're taking any supplements or medications. And it actually used to be at the top near the instructions, and everyone would skip it because I think they thought it was part of the instructions. So I moved it down to the bottom this year, and everyone's filled it up.
Nice, good.
People, the eye doesn't skip it anymore.
Good.
Because it's not part of the instructions.
Yeah, that's right.
So I usually get some random medication knowledge there where I'm like, I have no idea what this is for. Can you tell me? And then that's how I learn new medications.
Yeah.
Or it's interesting to see how many people take like ashwagandha or like creatine. Everyone takes creatine.
Everyone takes creatine. Good job, everybody.
David H. also said for things to follow up with on the physical, I live in the Central Valley, so if you don't have some sort of asthma, you're really lucky. For us, it's the difference between vocal cord dysfunction and asthma. Which I had never heard of vocal cord dysfunction before grad school, and I've never had an athlete actually with it.
Yeah, neither.
But I think it's really fascinating. Like, I feel like it's actually pretty common, even though like I haven't seen any, but like I feel like I hear about it more often than I would think.
We heard it in our doctorate.
We did.
Yeah.
We did.
Yeah.
We
I was in charge of that.
We read a.
Yeah.
We did a little journal thing about it. Right?
That was my section that I had to do. That I had to.
I
lead.
mentally blocked out that.
But yes, yeah. I feel like it was kind of like a really buzzword condition like a couple years ago. Like everyone was talking about like vocal cord
like 5 years ago, right?
But then like now like no one talks about vocal cord dysfunction.
No, I have not seen it come through.
Yeah. But it was big like 5 years ago. I remember there was a lot of NATA topics on it and a lot of presentations on it. So maybe it's more out there now. People are a little more familiar.
Yeah. I feel like the big buzzword right now is like cartilage, Macy procedure, Amicel. Okay.
I haven't heard I only heard it from you. I actually haven't heard the Macy
I've
procedure.
had 2 people who have been recommended, and then like 4 or 5 people with cartilage tears, and then recently, and then I saw at CATA someone did a case study.
Nice.
Presentation. I was like, man, this is a hot topic right now.
I feel like we're getting the tail end of like vertigo and stuff.
Oh yeah,
like, that was
a really big one.
But now I'm starting to slowly see like you don't see as many sessions on it anymore.
No,
it's starting to phase out.
Yeah.
Now I am trying to think. Okay, what is the new like really big one?
I don't know.
I mean, maybe it is Macy procedure. And I'm just.
You're behind the times.
Yeah, apparently I need to catch up.
So speaking of catching up, I hope you guys had enough time to catch up over the summer with the rest of our episodes. Actually, it's pretty interesting. I don't know about you guys, but sometimes if I ever go back, like I can barely remember some of the episodes that we have done in the past, like even though we're sitting here living it. So it's sometimes fun to go back and see like what we've done. And I'm sure if you're looking for a topic, I'm still trying to put together that podcast directory so you guys can better find some of our old episodes. So, I mean, they do live on, but they only live on if you access them. So, there are some cool topics that we've had in the past. And if there's something you want to hear in the future, please reach out, as we are still piecing together and trying to figure out what exactly we're putting together this season. We do have our CUs still available. On our website, we have some AT discounts and some other things. We're going to try to put that directory up pretty soon. And maybe some patches and some other podcast merch on the way. Were you going to say something?
Yeah, I was just going to say, speaking of like older like episodes and stuff, what's crazy to think is being season 6, like some of our education episodes from our first season can be updated this year with new literature.
We're going to be getting a lot of updates.
Yeah, so that's how long it's kind of been since those episodes. So we can actually provide some, here's what the literature says now.
I think that's all I have.
Thank you for helping us showcase athletic training behind the tape. Bye.